The state legislature is wrapping up its annual 60-day session in Tallahassee. The lawmakers there are slated to go home next Friday. Before they do, they have some very big decisions to make, and many of them depend on what the Speaker of the House wants to do. His name is Will Weatherford. He is from the Tampa area, and I spoke with him by satellite late this week. Bring us up to date on some of the major issues that you are still struggling with in Tallahassee, starting with Medicaid expansion. Where is that going to go?
Yeah, well, there's certainly a lot of big issues floating around Tallahassee these days, and probably none bigger than what to do about Medicaid expansion. You know, I'll tell you, we've debated that quite a bit. Today we passed off a bill, what we consider the House version, which is an alternative to Medicaid expansion. The challenge, Michael, to be quite frank with you, is that the Medicaid expansion that's being offered by Washington, D.C. and Congress is one that is an all-or-nothing approach, and essentially you have to take $7 billion of federal funds with very little flexibility, and you're putting people on Medicaid, which has a lot of challenges with it. That we've proposed is a free market plan. It's one that empowers and enables us to serve the most vulnerable in our state, but also embraces the free market principles of private sector plans. You know, Blue Cross Blue Shield and Aetna and United and those private plans that we think provide better service and better accessibility than Medicaid does.
All right. Well, let me ask you about that, because as I understand it, one of your objections, and that of many House members, is that the expansion plan, as proposed by Washington at least, covers a lot of childless adults. But of course, a lot of childless adults need basic kind of coverage as well. They don't get it now. What's wrong with covering more than the disabled or the elderly, the very sick, the very poor?
We want everybody to have health insurance. I don't think this is a debate about whether or not we want people to have health coverage. We want everyone to have it. The challenge is, how do you pay for it? How do you make it sustainable? What the federal government's offering us is to pay for it for the first couple of years, and then it's left up to the states to have to figure out how they're going to meet that shortfall. That shortfall could be to the tune of $3 or $4 billion, if not more. That could put the state in a huge bind. On top of that, what our plan does is it endorses the free market approach and says, you know, if you're a child in the state of Florida, we're going to make sure you have access to high quality care. If you're disabled in Florida, we're going to make sure you have access to quality care. If you're the parent of a child on Medicaid and you have dependents, we believe we're going to get you that access to care. But there are several, really a couple 100,000 of what we call childless adults. They're between the ages of 21 and 63. They can work, they're able-bodied, and we believe that that population is a very expensive population, and before we put them on a system like Medicaid where the outcomes are questionable, we want to incentivize them to get into the federal exchange where they can buy a free market plan through the federal exchange that the President has proposed and get better health care and better outcomes.
Let me move on to another bill that is of huge interest, or big interest at least, in South Florida, and that is the bill in the House sponsored by Representative Eddie Gonzalez of Hialeah that would give the Miami Dolphins $3 million a year sales tax rebate for Sun Life Stadium, and also allow for the tourist bed tax to be raised by 1% in mainland Miami-Dade County hotels. Where does this stand, and where's it going to go? Will it get to the House floor for a vote?
It's a good question. The bill has moved through the Florida House through two committees. It is currently residing in the Full Appropriations Committee. The chairman of the Appropriations Committee did not want to hear the bill, and so right now I would say it's stalled in the House. However, there's conversations that the Senate may be sending something over to the Florida House, but they've been saying that for a few weeks now, and we haven't seen anything yet. And so I think the challenge with the sports franchise bill in Miami and really around the state is it's not the only franchise bill. There's a bill that helps the Jacksonville Jaguars renovate their stadium. There's a bill that helps renovate the Speedway in Daytona. There's a bill that creates a soccer stadium in Orlando, and many others. And so I think the challenge the legislature's had is how to pick one of those issues and pass it and ignore the others.
And, Mr. Speaker, where do you personally stand on this? This is a member's bill. It's not a leadership bill. Are you lukewarm? Are you indifferent? Where do you stand on it?
Well, I think it's a tough issue. You know, I think that I certainly understand where the Dolphins are coming from. They've got a stadium that they believe needs renovations. They're trying to lure Super Bowl to Florida. We know that that can create economic prosperity and opportunity down in South Florida. At the same time, it's hard to address any one of those franchise bills alone because they have all been kind of cobbled together in the Senate. And so it's hard to say that one stands out from the other. They all individually have merits. But the question is, are the citizens of Florida wanting us to spend $350 to $400 million in tax rebates to build stadiums and renovate facilities like that, as opposed to doing tax cuts or providing health care through plans like what we're passing off of our floor today. So it's not that there's any one of them that's bad policy. It's the totality of all those bills that's complicated the situation.
And Speaker Will Weatherford also says he prefers to go slow on reforming citizens' property insurance. Up next, we will